My name is Molly Belsky. I am a communications associate with the Ripple Foundation, and I'm also on our Healing Home Care team, which you will hear a little bit about that project today. And I'm thrilled to welcome you to this edition of our ReThink Health Toolbox webinar series. Today, we are going to talk about shared stewardship, but we are going to do that through the lens of the home care industry. And we're going to hear directly from two home care workers who are really key to our system of health and well-being, really key to our project as well, but especially really key to our system of health and well-being, and who really, as you'll see, exhibit really strong qualities of shared stewardship, even while their industry is overlooked and undervalued. As we go on, please feel free to put any questions you have in chat. We have a number of team members who will be monitoring the chat, but there will also be some time at the end for some Q&A. So I ask that you please hold any verbal questions until that time. Okay, so just to set the scene a little bit, here at the Ripple Foundation, we work across the country with all kinds of partners to influence efforts towards improving health and well-being. And we do this by joining with others to realize our quite ambitious North Star of all people and places thriving together with no exceptions. And we really do mean it when we say that. That's not just something that we say. We really believe that we can get to a place where all people and places are thriving. And we do this work by working with stewards. Stewards are people and organizations who work with others to create conditions where the conditions that everyone needs to thrive together, beginning with those who are struggling and suffering. It's really important to remember that anyone can be a steward. And at Ripple, we see stewardship as a practice. And we really believe that shared stewardship, which is stewards working with each other to achieve large-scale change, we see shared stewardship as the key to a future where everyone can thrive. We help our partners recognize those practices of stewardship within themselves and within others. And in a previous Toolbox webinar, we gave an introduction to shared stewardship. I think there's a link to that being put in chat, and I really encourage you to check that out if you want to learn more. But for our purposes today, you can think of stewards as folks who work to make change happen at all levels, be that local, state, federal, who both can see the big picture of what needs to change, but who also at the same time can really see their own individual and interconnected role in making that change happen, in bringing about that change. We also know that right now is a great time to lean into shared stewardship. I know that's an understatement, and we're really at a crucial moment for shifting systems and truly working together to create a better future. And like I said, we're going to explore some of those themes today through the lens of the home care industry, which is the focus of Ripple's Healing Home Care initiative. This is a 3-year project. It's funded by the Robert Wood Johnson Foundation, and it's in close partnership with the U.S. Federation of Worker Cooperatives. And it's centered on home care workers to uplift their dignity and well-being. The home care sector, as many of us know, has long faced systemic challenges, and it's really time to rethink how we engage with home care professionals and with the industry as a whole. Our goal as a project is to bring together multi-sector teams, including home care workers and other healthcare professionals and community leaders, policymakers, service providers, and really anyone who touches the home care sector directly or indirectly. Many of us have connections to the home care sector in many different ways, and we all have a part in shifting systems on behalf of home care workers. And we want these multi-sector teams to work together on solutions and to discover what it truly takes to move to action, to move beyond conversation, and to actually create change to improve the careers and lives and well-being of home care workers. Now, this is centered on home care workers, but it is not just about home care workers. We know, and you'll hear, that making things better for home care workers not only improves their well-being, but can improve the well-being of those for whom they care, their families, and whole communities. They're really a cornerstone of the care community. And by caring for some of the most vulnerable among us, home care workers are really essential. Like, they put the essential and essential workers. I know we've heard essential workers many, many times over the last few years. But I think, as you'll hear today, that really, really rings true in their case. So without further ado, I am going to do a little less talking and introduce you to the two wonderful women that I'll be speaking with today. Terrell Cannon and Nikita Kirby are both worker owners and employees of Home Care Associates in Philadelphia. They both are longtime home care workers and longtime residents of Philadelphia. I'm so excited to have them here. They are also representing the Healing Home Care Project. Terrell is a senior fellow of the Home Care Project, the Healing Home Care Project, and Nikita is a fellow as well. So they've been working with us, going through trainings and helping us really shape what this project will look like. I could not be more thrilled to introduce the two of them today. I'm going to stop sharing and give them both a chance to introduce themselves. Terrell, I would love to start with you.
Hello, welcome everyone. Glad that you all could join us today. I am honored to be and excited about this conversation that we're having today. I am Terrell Cannon. I am the Director of Training for Home Care Associates and a Senior Fellow for the Healing Home Care Initiative.
Thank you, Terrell. Nikita, why don't you introduce yourself?
Hello, everyone. Happy afternoon to you all. I am Nikita Kirby. I am a Home Care Associate. I work at Home Care Associates. I'm also a fellow as well, and I'm looking forward to talking to all of you and just enjoying today the conversation. This is my first time being a fellow, so I'm just learning a lot of new things and very interested in how we can expand home care and help all of our consumers as well as our coworkers as well. So thank you very much, and hello to everyone again.
Thank you both. I really want to start by kind of helping you both set the stage. I think people here might have varying levels of understanding of the home care industry and what your day-to-day really is like. And in order to shift the system of care, we really need to first bring people into understanding of what it's really like to be a home care worker. So with that in mind, I'm going to ask you both to share what a typical working day looks like for you. And just, I would maybe focus on what you really want people to know about you and your typical day. Nikita, let's start with you.
My typical day is I get up in the morning. I have one consumer that's living far away from me, and I go in with a smile and good morning, and how was your evening? How did you sleep? Just going in anything, daily activities that she may need during the day, as feeding, going to the bathroom, meals, food, medication, or anything like that, communicating with the family members as well. But that's usually my day starting from 10:30 to 6:30. I have one consumer. I've had her for about almost 3 years now, and she's a joy to have. But it is you do have to take your time, and I have to take my time and patience with her because she does suffer from dementia. So it is a process. Sometimes she's not at her best. Sometimes she is at her best. But I just go in with the same positive attitude and the same communication with her. Nothing changes. I go in with a smile and caring for my consumer.
Thank you, Nikita. And just for folks who maybe aren't as familiar with the terminology, could you just share, either one of you, what we mean when we say consumer?
Consumer means basically a patient. We use consumer, but it's basically a patient, someone that you care for during the certain hours that you're in their home or in an independent living facility where they get care through their health insurance or through private pay. So basically what a consumer is actually a patient. But we use consumer because patients usually use for the hospitals and the nursing homes. but we do the outside care after they get discharged from the home, or they get discharged from the hospital or from the nursing home. We are the ones that are in their home caring for them on a daily basis. So that's really basically what a consumer is.
We like,
The consumers of care.
yeah, we like to look at the consumers as a person that came to us for a service. So because they come to us for a service, which is their home care service, we like them to have that autonomy and getting the respect and dignity that they deserve as a consumer, as you would if you were walking into a regular grocery store.
Thank you, Terrell. With that, Terrell, would you mind also sharing about your typical day?
My typical day starts a little different, but kind of the same. I have a consumer I care for as well. But before I even get there, I have to do some care with my mom. So before I go to any place, I have to check in on my mom first. That usually starts about 6:30 in the morning. And then I get to my consumer around 8. I'm there with her until 7 p.m. And then the in-between time is filled with the activities that her preference. And I'll point out that in this work, in my everyday, I had to learn to shift a little bit because with my consumer that I have, her culture is a little different. So there's things, she's into the arts and things of that nature. And one of the things that's a major for her is that we have to watch opera from 10 to 11:30. So from 10 to 11:30, we're watching the opera. And which was a little different for me because you have to be quiet and don't say anything. And I'm always like, look at the costumes. Oh, look at the set. And she's like, shh. So in our typical day, it's filled with lots of artsy things outside of the normal bathing, dressing, feeding. She can feed herself, so I make sure she gets to her the place she lives has a dining restaurant for the residents. So she goes to the dining room and I make sure that I can't sit in there with her, but I sit near where I can see her. Because of her Parkinson's, I have to make sure that she is swallowing all of her food, as well as her beverages or are able to hold the beverages in a glass without the shakes that she get from the Parkinson's. Some days she doesn't have really good days because she shake a lot. So in this job, you have to know how to kind of change pace a little bit. So she gets frustrated with her shaking. So I told her, well, I said, well, it is shaking, but we're going to call it Zumba. So that's the time I get the range of motion in. So I use her shakes as a way to dance and, get her to do some exercise. And I look at it as a hindrance for her, which she actually enjoys because her legs don't shake a lot, but I find her shaking her legs now because we're doing what we call our Parkinson Zumba. So in our field day from 8 to 7 is the hardest thing that I have is when I leave her, although she tells me I'm tired and I want to go to sleep, is because I know that when I leave her, she's alone. And she don't see anyone until 8 in the morning. So I often leave little notes because I know she's going to sleep. So when I leave out, I write a little note and I attach it to right where her phone is because her first phone call is her son, but she'll see that note that I left, and the one that I left the other day was that you're beautiful. So she will see a positive message every morning when she gets up.
Wow. Both of you, this note in the chat, your consumers are so lucky to have you. I feel lucky to work with both of you, and I really, it's just really clear how amazing it is for you both to be showing up with so much love and care, despite perhaps a difficult job. I wonder if you both could share some of the things that make the job difficult. And perhaps, yeah, let's start there. Maybe just the things that make it a bit of a harder job. Terrell, we'll start with you.
For me, sometimes I don't, in this work, we don't have all the supplies that we need. Because in some cases with their insurances, it doesn't pay for certain things that we find that they may need, like a bed pad, so to speak. I often find that sometimes in this work, there is not enough support for us as caregivers for the things that we do with the consumers, because sometimes we'll start something with the consumer and the family or may not, think that although the consumer um feels that it's conducive to their care and it's helpful for them and they enjoy it, the family may feel sometimes that it's a waste of time, and will sometimes get in the way of that happening a little bit. Um, the other parts of that is when the consumers, for me, some of the industry things get in the way of like resources, not just for us, but for consumers as well. Because they're not able to do, first of all, they're not able to do and move like they have before this illness or whatever caused them to get home care. And now that because they got home care, there's this resistance for them to be able to partake in some of the things we do every day. That's why the opera is important for my consumer, and I make sure that we go to the opera on time, so we can get that because that's like her out. Um, and she doesn't really get out to see outside of the apartment building that she's in. So sometimes it's transportation that gets in the way because then we have to wait for a certain bus, they got a lift and to be able to get our consumers out because maybe the insurance doesn't pay for them to be eligible to ride paratransit or CCT, or they don't have the money to be able to pay out of pocket to pay for those things to get to different places that they like. For her and I, we watched the opera on the TV, but I would love to get her to the opera house. And that's one of my goals is to get her to the opera house, before I or her are not here anymore. Because I know that, in her previous life, previous time, she conducted some of the opera. She was a part of the theater and she misses it. So sometimes it's where someone may see it very small, it may get in the way. For example, when we were doing Zumba, one of the people in the apartment building complained that we were making too much noise. But she was exercising and we were having fun and she was speaking more. They say she's quiet, she's no longer quiet. So sometimes those small resistance kind of get in the way of the progression of the care or quality of the service for the consumer for me.
Yeah. Yeah, I'm hearing a lot of in your answer, I'm hearing a lot of some of the stewardship practices that I talked about already. You're really invested in building trust with her and making sure that you have that individualized trust. And you're valuing her voice and her life in a way that that perhaps others would not. So that's um, I'm really glad to hear some of that. Nikita, would you mind talking a little bit about your just some of the things that make the job more difficult?
Mine's a little bit different than Terrell's, but it is kind of a little similar with my consumer. She suffers from dementia. So we're at a point now where uh, there's certain topics and certain things that upset her, where, for instance, her parents, she doesn't remember certain things. And when something is told to her by a family member, she's very emotional, very upset about it. She asks for a lot of questions sometimes when she's sundown. No one cares about me. Nobody loves me. No one comes and sees me. I don't have anyone. So it's a thing of encouraging her, but also on the family side, she has a portal where you can portal in to encourage more of them to come. And even if they can't get there to get the portal information, so that she can at least see you and talk to you. And she has a sister lives around the corner from her. So she was very happy to see her on video chat and talk to her because sometimes it's very, she gets very upset, and sometimes it's very difficult to deal with that when she's sundowning, because sometimes it just, I could tell her every day, well, we love you, we care about you. I said, that's why I come here every single day, because you're my number one star. And it sometimes it's a little difficult. So with the family also too, it's new for them. They've never experienced this before with anyone in their family. So it's a little difficult. I have personally with my grandmother going through it. But it wasn't as this way, where it's like you don't know when you're coming in if this is going to be a sundowning day. And a lot of times that's how was your night? And the family sometimes will say, well, she had a difficult night. And, during the day, she may be a little sundowning, she may not be a little sundowning, but the major topic is her family. She wants to see her family. She wants to talk to them. And sometimes she just feels like, no one comes to see me. I'm nothing. And it's like, it's not true. It's not true. They love you very, very much. They're working to make sure you get the best care from us. We love you, we care about you. But it's now lately, as it's getting warmer, her nephew's able to come by and see her and sit with her and talk to her. So she's very happy to see that. And, we're just encouraging a lot of relatives to get on the portal, get the information from her daughter so that she can see your face and she can talk to you and talk about things and things like that, because it helps out a lot with her sundown. It really encourages her to, she's very happy when she sees them, and she'll talk about different things she remembers, and it really helps her. So that sometimes can be a little bit difficult. I always go in with the notion of, if she does sundown, being prepared how to take the baby steps with her with certain conversations. And the major thing is you don't want to get them upset. I've tried to find myself, she's having a bad day. She's not really feeling anything. She may not want to eat anything. You can encourage it, but you do it in a loving, caring way and a gentle way. And so it's working. It's working, but sometimes it can be a little difficult, especially when she may be very, very upset that day. So sometimes I just give her a big hug and just encourage her, and it helps. So I would say that was the difficult part sometimes I may go through.
Yeah. Thank you. Thank you both. This perhaps doesn't need underlining, but for everyone else, I think I would like to underline just what an emotional and heavily emotionally investing job this is. This is really deeply heart work, and incredibly difficult work, that Terrell and Nikita do. And I think, these are kind of individual difficulties of your day to day. Now I want to zoom out a little bit. As we know, in Healing Home Care, we talk about some of the things that we would like to see shift in the home care industry. It is a very underpaid profession. It can be very erratic with hours and under benefits. It's also, it can be a very unsafe job. There's really high rates of on-the-job injuries for home care workers. And, things are different for training and regulations, agency by agency, state by state. And so a lot of those things make for a really fraught industry. And I've talked with both of you about the things that we would like to change. But starting with Terrell, I'd like to hear about if you could just change one policy or practice tomorrow in the home care industry, where would you start?
Those that know me know I'll say reimbursement rates. So in Pennsylvania, our reimbursement rates is not conducive to the care and the work that caregivers are doing, or the care that consumers receive. They're so low in that we're not able to pay our workers what we would love to pay them for the hard and the vital and hard job that they do. And at the same time, it does not provide enough money for resources for people to get the services that they need, for especially personal assistance services. So I have a list of things that can change, but the one main thing for me is those reimbursement rates, because if it stays the same, our most vulnerable population and our baby boomers are here now, you know, are not going to be able to get the quality of service that they need to live independent lives until the end of their lives. So for me, that's something I continue to work at, focus on, collaborate with folks with, calling legislators, sending letters out to try to help with that, because we really, really need the reimbursement rates to change, to go up, so that we can provide our workers with the quality job and continue to provide our consumers with quality care.
Thank you, Terrell. Would you mind just quickly, I think many people know what this means, but just describing a little bit of what you mean by reimbursement rates?
So for home care, the state has a reimbursement rate. So what that means is that agency will provide a service to a consumer, and let's say we provide that service. The state is only going to pay out the $20.10 that for the personal assistance services. Now, say for an agency that's paying an aide $15 an hour, and the reimbursement rate, well, the 2002 is the larger number across different states, but the real number is 19. So let's say we pay $15 for aide for their pay rate. We only get reimbursed $19 of that, right? So for us, because where we work at Home Care Associates, we are a co-op, the majority of that reimbursement goes back into the workers. We pay them $15 an hour. We pay for all of the benefits, including a discounted travel pass, as well as benefits as far as like having your birthday off and being paid, because these are things we value in our caregivers. But the company takes a loss in that, because with that $19, we're only actually seeing 10 cents of it as an organization. So if those reimbursement rates don't go up, we will be going downhill, because the one thing we're not going to do is stop supporting our workers, because without our workers providing that service to our consumers, we have no business. So we want to make sure we instill in our workers, but again, with the money that comes back for the service that we put out doesn't match, it doesn't help either the organization or the consumer, because that reimbursement rate is only covering what we're actually paying out to the workers.
Thank you. I want to highlight that because I'm hearing another essential stewardship practice, committing to multi-solving in what you're saying and describing of how reimbursement rates not only can help raise the pay for you and your fellow workers, but also can help out your consumers and make sure that everybody is getting the care that they need without breaking the bank. This, I think and home care, and we really see home care in general as a multi-solver, which we can talk more about, but I wanted to raise that up as well. Nikita, I would love to hear what is just one thing of, I know many, that you would change.
For our consumers, equipment, like outside having I want to see like donors, governor, the mayor donating, having a funding for if you're outside your Medicare and Medicaid and your health insurance, some of the consumers cannot get a better bed. They may need a better bed because your bed is like years old, or a wheelchair, or a Hoyer lift, or an easy stand, or a walker, or a cane, to have that extra money on the side that says, okay, if Medicare and Medicaid can't pay, or the health insurance can't pay, they're already paying for medications, they're already paying for if they need surgeries, things like that. Having a funding in each state by the upper governor and the mayor that says, okay, well, you can have this to pay for something that you need, because sometimes that's like when we need bus fare and things like that, we have key cards, or if you need to put gas in your car to get to work. This is what some of the consumers have to depend on every day. They can't walk by themselves. So this is their transportation. The chair is like a car to them. If it breaks down, and some people have come in the past with consumer, it was like $3,000 for him to get a new one. Where is the money coming at? If Medicare, Medicaid say, well, I'm not going to pay for that, or we can't pay for that. You got to pay for out of pocket. To have something set up in each state that if that should happen, this money can kick in and this consumers can get what they need to have a comfortable life, to survive, to feel comfortable, where they don't feel that they have to be bed rented because they can't get out their bed because they don't have the right type of equipment to walk around with. So I feel as though that getting our governors, our mayors, anyone else, any donors, anyone that has wealthy CEOs or people that live in their state, to get them on board, to petition with them, hey, you know, how you want to be help a pillar to your community, to help out with getting extra funding to help with these things that our consumers need.
Thank you. And you definitely touched on, you know, some of the systems, the way that the breakdown of a system of transportation, say, might harm your consumers and the home care workers as well. So thank you for kind of connecting it to big picture. I have a final question for the two of you, and then we're going to open it up. There's already a couple of questions in chat. We'll open it up to the rest of the room. I started this by talking about stewards and how stewards, join with others, work really closely together with others to create really big, large scale change, even if the things that stewards do seem small. There are many different ways that stewards can lean into their roles as change makers. I know you both to be stewards, so I would love to hear just one or a few things that you're doing to show up as a steward today to create a better future for home care. Terrell, we can start with you.
So as a steward, I continue to advocate for the care work. I have done some panelists in the visit to Capitol Hill. I've been to Washington, to the White House. I attend various different conferences to speak on this. I show up at meetings that is not actually dedicated for us, but I show up with my signs and my words and my being to show what it's like for us as workers and to end the ask of how can you support us. I follow up with folks as well, because again, in this work, I don't look at, sometimes people put race into play and things like that, but for me, we're all one race, and that's the human race. So with that, I go out for all of us to be able to have, again, quality jobs and quality care, because I believe that by 2030, this industry is the industry that's booming. Our baby boomers are getting older. Everybody is going home. No one wants to be in the hospital, and they're going to need the care at home. So if the support is not for the caregivers or the quality care of the consumers, then what are we doing? So for me, I show up as a steward in my everyday life and also outside of work. I'm a walking advocate for caregivers as well as consumers. It doesn't just stop because of my 9 to 5. I may go to the grocery store and I may meet someone and there I am. Okay, here's the resources I have. This is where we can help. This is who you can call. Or can I walk with you? Can I help you or assist you in any manner? Because again, without us doing this collectively, we're not with it. Someone always told me that it's power in numbers. So I tend to always grasp onto that. And as I go out in the community and work with people, talk with people, attend these different symposiums, I often try to gain a group that is like-minded, and we do this together and follow up with each other together. So being a part of the Healing Home Care Project was like a no-brainer for me, because this is just the walk of my life. And I enjoy every bit of it, because if I have a voice that someone else is mute from, then so be it. Give me your words, I'll say it for you if you're not, able or don't want to.
That's so wonderful, Terrell, and so true for you all. If you walk around Philadelphia with Terrell, she knows everybody we pass, even if she doesn't know them, she's saying, hey. She is just a very deeply caring and community-minded person to her core. Nikita, how are you in many ways? I know you are showing up as a steward, but I wonder if you could share just a bit of how you're leaning into stewardship.
Actually, my next door neighbor, I have been talking to her because her niece and her niece's mother-in-law also both have home care companies. So I've been trying to get them to come out to our wonderful events to see what it's about. But it's been a kind of little struggle because unfortunately, what has been going on with some home care places, not all places, that it's taken as a recruitment. And I've explained, no, it's not a recruitment. Just come out, share your stories. You might, consider joining the co-op. I'm there. I have a great coworkers, great colleagues. I know Yvette's in here, so shout out to Yvette. But it's just an event where all home care different places come, and we just all tell our story, talk about things you want to change at your home care place, talk about things that you want to bring towards to help your coworkers or your supervisors. Like Terrell said, it's strength in numbers. We're all in this together. So we're all trying to help each other to get to the next level, to get to a point where everything is smooth running, everything is being done, and we're all happy. So we can't get to the end of the race if some are in the back. We got to bring them with us. But I'm still working on that. I've been doing that for a while. So hopefully there will be a change, and they will be interested in joining and coming to the next event. So that's what I've been doing.
Thank you. And thank you for doing that. I think there is in just even the difficulty in getting folks to come to an organizing meeting does, I think, show a real lack of trust among different home care agencies, and many different home care agencies don't necessarily have the level of well-being of their workers that you all experience. And I actually do want to shift to audience questions and start. Jeff had a question about, he would like to hear a little bit more about the co-op. And I know Terrell, you talk about the co-op all the time. I wonder if you could share just a little bit about home care associates as a co-op and home care cooperatives in general.
So cooperative is an organization where the workers own the company. And home care associates, our workers, everyone in the organization owns the same share. So no one person is bigger than the other. So in the traditional agency where you hear them working from top down, we're the down that's working up. Right? So what I mean by that is you have a CEO of an organization, but in a co-op, the workers oversee the CEO's day-to-day operations. The workers are the ones that make the democratic decision makings. They sit decision making when there's decisions that need to be made for the business. The workers sit on the board. The board is made up of majority of the workers. The workers share in any profits that come from any profits that the organization make. And to do that, the workers run the committees that is connected to the board in the organization. For example, at Home Care Associates, we have a policy action group, a safety committee. We have a happiness committee as well. And we have community ambassadors and in the mentor program. So all of those committees are ran by the workers, and they all report to the worker owners, who then report to the board of directors. So the CEO of the company actually does her annual goals for the company each year, but that has to be approved by the workers. So in a co-op, the workers really run their business, because they're the ones actually sitting on the front line making the decisions for the business.
Thank you, Terrell.
Oh, I'm sorry. With
Oh,
that,
sorry, go ahead.
yeah, with that, we collaborate with other organizations like U.S. Federations of Worker Co-op, Philadelphia area, Philadelphia Alliance, the PACA. Sorry, because I know Corey is here as well, but we work with those different groups to better sustain our co-ops, and they provide assistance with us, whether it's technical assistance, helping you to get started up as a co-op, and helping you to maintain and run smoothly as a co-op. So as a cooperative, the workers are the ones that attend those meetings or sit on those boards to better run the business, part of which is why we're always, and you asked me about stewardship when it was asked to be a part of this, of course I would, because in a co-op, although we are maintaining a business for our business, we also look at it across the board for everyone. How can we help caregivers as a whole in this industry to, again, have a quality job, to be self-sufficient, and for consumers to receive quality care so that they can remain independent.
Thank you so much, Terrell. And I want to note, I see some chatter in the chat about the U.S. Federation of Worker Cooperatives. They are our partner in this work. That happened because really out of kind of kismet, we were in designing this project, we worked very closely with Mo Manklang at the U.S. Federation of Worker Cooperatives in imagining what a better future for home care workers could look like. And we were connected with Mo via Terrell, via speaking with Terrell, and we really, we as a project are not saying all home care agencies must convert to cooperatives. We just happen to be working very closely with a cooperative that shows a really high level of employee well-being and the practices of the cooperative, of, you know, valuing the voices of their workers, and really that level of respect for their employees is very, very high. And so they serve as a really good example of what quality care could look like if you really truly value your workers. So I wanted to note that as well. I'm wondering if my fellow my teammates could help me out a bit with directing me to a question, because I'm struggling to read them and talk. Oscar, I see you raising your hand.
Thank you. I have a question. We here in Sonoma County, we have a large number of immigrant and undocumented workers. And during the pandemic, a lot of our neighborhood level, community organizers started to engage and provide health promotora services in our community. And we've been looking at the co-op model as a way, or as a vehicle, to facilitate undocumented workers to actually be able to generate income beyond the gift card that somebody's able to provide to them. Is that something that your co-op facilitates, or have you heard of a co-op that has been used successfully to employ folks who may not have legal status?
Yes. So there are several co-ops that and we are connected. We have the National Domestic Worker Alliance. And I think that previously Corey Reedy, who's on this in this program, may have put that in the chat earlier. I think I saw that. And then you have PACA, which I mentioned before, that can help with that, as well as the U.S. Federation of Worker Co-ops and the ICA group.
Thank you.
Thank you. There's another question from Becky in the chat. How can, when you think about, healthcare entities in power, hospital systems, more traditional power holders in the healthcare space, how would you like to be more supported by those folks and folks in those sectors? And how can they support you to become visible in negotiations and discussions of healthcare?
So one is to email righteous legislators to change those reimbursement rates. To do, please, if you can do that. The other is to, if you're in a hospital or if you're in any arena with navigating care, to try to begin to push the initiative to include home care workers to sit at the table when care plans or ISPs or things like that are being developed for the consumers. So that way that the care worker can now just not only be more involved in that piece, but also can have some leadership and in that, on that care team, because the care worker is the person that actually spends the most time with the consumers. To be able to work with us in trying to change the small print for, small businesses where, home care agencies, because we're small businesses, we're not able to get small business loans without a personal guarantee. So if we can, again, work to try to rid of that personal guarantee so that our agencies can get the funds that they need to better support the workers and the consumers is really helpful. And if that means going to those tables with us, being a part of groups like this, with us, becoming a stakeholder in the Healing Home Care Initiative, because that allows us to collaboratively put these things in place and maybe move the needle a little bit for the long haul. I think that will be helpful to also join us, continue to join us in the forums that we have when we're bringing together, the caregivers to hear their stories and things like that, to kind of better put some resources in place, for workers. Because, it's sad that it's the hardest job and the lowest paying job, although we have our own homes now, but it was hard to get there. It was hard to get to own my own car versus, if I went to work at a Fortune 500 a company or something, I wouldn't have liked anything that I did there. I enjoy my job I do here and want to be able to have the same opportunities as those that work in those Fortune 500 companies.
I couldn't have said it better myself. Thank you, Terrell. Thank you so much. I think we have time for one more question. If anyone, let me see, how are we doing? Okay, there's been a couple of questions asked and answered in chat. If anyone wants to come off mute and ask a question.
Hi, this is Liz Baxter calling from Washington State. I am just curious because of the questions about the co-op. Are we talking about the co-op the way that the 501 guidelines are set up? So like this is a co-op by design using the IRS definition, or is it a co-op kind of in spirit without that set of requirements?
Corey answered. Sorry, go if Terrell, if you have an
Go
answer.
ahead. I'm sorry.
Oh, I was just reading Corey's answer in chat because I'm certainly not an expert on this.
I lost all the response. I
No
have
worries.
I'm scrolling through the chat, but
it's not a nonprofit cooperative. HCA is a for-profit business with multiple owners. I don't even know how many owners. But thank you, Terrell. And thank you, Liz, for that question. I want to make sure that we close with enough time for our little closeout survey. I want to make sure, Tiana, do you want to say just 2 sentences about the Healing Home Care Initiative? Not to put you on the spot, but I want to make sure if there's anything you want to share, you get a chance to do that. You can also say no.
Kamal just put the link to it in the chat. I think you spoke to it really nicely, that we are bringing together multi-sector groups along with our home care workers. And so that might be nurses, doctors, government, legislation, and so forth, and racial justice. I think the list really goes on. It's anyone that cares about home care and bringing them together in the room to really not just uplift the dignity, but the value and the unheard voices of these home workers, goodness, I'm in my school, my little home care workers. And I think they said it both best today, Terrell and Nikita. And so if you know anyone in the Philadelphia area that we should be connected to, I'll just put that out there as well, that definitely have them connect with us. We want to be able to have these robust conversations, and not just these conversations, but leading with listening and learning, but also moving to action, right? What will it really take to change that home care ecosystem in Philadelphia? So.
Thank you. Thank you so much. Okay, well, if there are no final questions, I want to just close us out by thanking Terrell and Nikita so much for your time, and just bringing your whole heart and your whole selves to this conversation. I'm sure we're all sitting here with such gratitude for the two of them, and also thinking of, I should have said this at the top, of all of our connections to home care and the caregiving industry. I'm sure we all know and love home care workers, folks who receive long-term care. This is a very heart-centered issue for me, and I think for many of us. So just deep, deep gratitude to the two of you. There is a survey for today's conversation. Kamal, I believe, put a link in chat, and I think it will also open in your browser when you close this Zoom screen. Ciara, correct me if I'm wrong, but I think that's what will happen. Great, awesome. Thank you all so much, and I hope you have a wonderful day. If you want to know more about Healing Home Care, please reach out to any of us. Follow the links that are in chat. We will share out the recording of this conversation, as well as the slides and the links that were shared in chat after the fact. I really appreciate you all, and please enjoy this beautiful spring day.
I do have one more thing. Sorry, Molly. Again, thank you all for being here, but the next ReThink Health Toolbox webinar, it will be in June, and it will focus on a beta version of a new data and measurement hub that we're about to be launching, we as in Ripple. So during that webinar, we'll give you an overview of the hub and talk with local leaders on how they're actually using the vital conditions to assess their systems change efforts. So we invite you all to join and hope you're able to be there. So stay tuned for more information, and thank you again for joining today.